All right. So today on our Ask the Expert interview series, we have Dr. John Meyer with us, and we have Mr. Mark Prussian from the Eye Care Institute here in Louisville. So we appreciate you all taking the time to be with us today.
You're welcome.
We're going to talk about eye safety because this month, October, is kind of eye injury prevention month. And we're going to just go over a few things that are common eye injuries and how we can best prevent them, and any other topics that Dr. Meyer or Mr. Prussian want to go over. So we will just kind of jump in. As I said, October is Eye Injury Prevention Month, and statistics show that nearly 50% of eye injuries happen in the home. So what would you say in your experience is the most common household eye injury, or what causes that?
Well, just thinking back, there's a couple that come up more frequently than others. Typically, they're going to be either blunt trauma or like chemical exposure, kind of splash injuries, things like that. So talking about a chemical exposure, a chemical burn, chemical injuries, cleaning fluids and things like that probably come up pretty high on the list. Most of the time, it's not so much somebody who's using them, it's somebody who's preparing to use them. They're mixing chemicals, they're pouring, they're diluting bleach, or they're using something like that. And either, it splashes out of the bucket, or they drop the bucket and it splashes up in their face. Those are more typically the things that we see. As far as chemicals, there are a whole lot more alkaline chemicals in the home than there are acidic chemicals. Most of your cleaners tend to be kind of alkaline. The disadvantage is that most of those cleaners and alkaline burn injuries or alkaline burns tend to be a whole lot more significant. So those kind of injuries, it's not infrequent. We'll get, one a month, one every couple of months. It's a fairly significant chemical injury. Not all related to home, some industrial also. But then as far as blunt injuries and blunt trauma, corneal abrasions are really common. Anything that scratches across the surface of the eye can easily cause an abrasion, and they hurt like crazy. And it's real easy to get. Sometimes even vigorous eye rubbing can get something like that. So as far as the stories that we get or the common causes, I would say probably more typically for me, it is either they're poked in the eye with a fingernail, or they poke themselves in the eye with something else. So poked in the eye with a fingernail, I tried to think back and figure out what the most common causes, but it just seems to come back to me all the time that young kids poking adults seems to be more common. And the one that seems to be even difficult to prevent is holding an infant in your lap, facing away from you, while you are talking to somebody else, and you don't have all your attention on what the infant is doing. And they turn around and either knock you in the face with their head, or they reach around and you get poked in the eye with a fingernail. And infant fingernails can be really sharp. So that happens, a whole lot more frequently than I would think. Other ones would be poking yourself in the eye with something. So either you're working around in the yard and you bend over and you bump into a branch from a bush, or you're putting your glasses on and you poke yourself in the eye with one of the temples, or putting up Christmas decorations. Pretty much every Christmas we'll get one or two corneal abrasions from a Christmas tree. So you're reaching over, you're putting ornaments on, you're doing things to the tree, and you get hit in the eye and get an abrasion from that.
Sure.
So those are probably the more common ones.
Okay.
So what can you do to prevent that?
Let's jump in here, Dr. Meyer, if I can.
Oh, sure.
So for the people watching, most of what you have been describing is what we call a trauma or an injury. And you and I have discussed many times why the emergency room is not typically the best place for an eye trauma to receive care. Would you talk about the emergency room and eye care for just a minute, please?
Yes, and that's, emergency room. Everybody has this. I have an acute problem. It's an emergency. We'll go to the emergency room. They have people there who can take care of that, and they do a really good job. If you can't breathe, or if you're bleeding and you can't stop it, or if you're having a heart attack, definitely go to the emergency room. A lot of what we see as far as eyes are concerned are not really emergencies. They're urgent, they're alarming, but that reflex to go to the emergency room, is good to have somebody look at it. But often what happens is you're going to go and you're going to sit for hours. You're going to see a doctor who doesn't see a lot of eye injuries. They don't see a lot of things. They will start some kind of treatment. They will end up essentially calling someone like us and then setting up a follow-up appointment to go see us later. So there are certain things that can be done before you get to the emergency room, which probably should be done rather than delay that to get to the emergency room. Chemical injuries or chemical burns are the way. The treatment or the thing to do immediately when you get some kind of chemical in your eyes, wash it out. Wash it out for 15 minutes, 20 minutes with just tap water. And don't delay that immediate treatment to take the time to drive to the emergency room and get that, because you're going to lose ground really quickly with that. But often the ER docs will take a look at you and say, I'm going to do the best I can, but I'm not really an eye doc, and you're going to have to go see someone else anyway. If you were just to call an eye doc immediately, that would save a whole lot of time and often a whole lot of expense. And we can deal with things, sometimes deal with them over the phone. Sometimes we can meet you in the office here and take care of it pretty easily. But, as far as eye injuries, eye trauma, eye issues, eye conditions, best to call an eye care provider directly. Most all practices have answering service that they answer all the time. Some, more quickly than others, but I would say that's the best way to go first.
That's very good. Yep. I like that, adding on kind of the information to wash the eye and make sure that you take that step before getting in the car and losing those 30 minutes. So that's a good recommendation. So I'm going to skip one of the questions. I'm going to just go straight to, do you recommend wearing protective eyewear for any type of activities around the home? And kind of, if so, what special eyewear do you recommend?
Okay, what's going to be best? So in general, you can lump pretty much any eye injury together and say the best thing to do to prevent that would be wearing some kind of safety glasses, some kind of eye protection barrier between you and whatever is out there that's trying to get at you. So as far as, trauma, blunt trauma, poked in the eye, if people who wear glasses are much less likely to get poked in the eye with something. People who are working with chemicals, if there's a splash, the glasses will prevent, or will be one more barrier to keep things away from your eyes. So safety glasses, definitely, I think that's the best thing that anybody can do. If you have one takeaway from this entire talk, it's safety glasses are a great idea. You should wear them. So if you're going to be working with some kind of caustic chemicals, yes, wear gloves, wear safety glasses, things like that are a good idea. If you get some kind of chemicals on your hands, and after you're finished, you take off your safety glasses and you go doing about your business and you rub your eye, often there's enough residual on your hand that you can cause a problem. And it's really easy to tell that if you're making some kind of chili or something, you're working with chili peppers, you're cutting them up, you're doing all that, it's all cleaned up, it's all put away. An hour later, you got an itch and you rub your eye and you can still feel that burn. So it stays on your skin for a really long time. So be extra careful about, wearing gloves, and you can take them off and then your exposure goes away. Safety glasses for household activities, cleaning things, working in a shop, hammering, grinding, yard work, things like that. It's really a no-brainer to wear the safety glasses. Now you can get injured around the house doing things that really are low risk. So wearing safety glasses for all of your household chores, I don't know, you could prevent an injury from, a paper cut when you're at the desk if you had safety glasses on, but practically, there's going to be a limit to how much you can wear them. But yes, anybody who's doing anything that puts them at risk, safety glasses are a great idea. What kind of safety glasses? There are lots of different ones out there. You can go to the hardware store, you can buy all kinds. You can go to a sporting goods store and get like rec specs or sports goggles. You can go to an optical shop and have real, work style, work quality safety glasses made. Ultimately, the best would be a polycarbonate lens. That is the toughest, the hardest to break. So if you're doing things where there's a potential of things flying around you, weed eating, a couple of times a year, we get some really serious string trimmer injuries. And I've seen them actually break safety glasses. So polycarbonate lenses are the strongest, the toughest. That's smart. Ones that wrap around the sides. A lot of times things can enter from the sides. So side shields are ones that curve around, or goggles that are fully occlusive to go all the way around too. And that will help keep more fumes and dusts and things out. So depending on the activity, there's probably a variety of different, safety glasses. I would think you should have a few, have a bunch, put some in the shop, put some in the garage, put some in the kitchen, put some in the place where you keep your cleaning materials. Because often people have good intentions and they say, oh, I'm just going to do this for a little while. And my safety glasses are in the basement. So they say, I'll be fine. And, not always you are fine. So buy a whole bunch of different styles based on what you are doing. The fully occlusive ones will keep, dust from a mower from getting in your eyes. A polycarbonate lens may prevent something from snapping off and hitting you in the eye when you're hammering or you're wedging something out. So the more the better, I think.
Yep. So you touched on this just a little while ago, but on how many eye injury cases you treat a year, do you kind of have an estimate of how many just in your office here in Louisville you see?
I think we have 5 doctors here who are seeing patients pretty much every day. And between all of us, I would say that we probably will get 2 to 4 eye injuries a week. A variety of different ones. But if you add all that together, we're seeing a couple hundred a year, just in acute eye injuries, spread out between home and office and school and sports and other things. But it's fairly frequent.
Is there a season of the year that maybe you have more than others? I would assume that summer would be a heavy one because everybody's outside working, but is that accurate, or does it kind of spread evenly throughout the year?
No, that's pretty accurate. At least I haven't really analyzed it specifically, but in my mind, yes, summertime, we do see a whole lot more injuries. People are outside, they're more active, they're out in the woods, they're working in the yard, they're playing sports. Wintertime, people tend to be more inside and maybe a little bit more sedate. But one thing that does come to mind, as we get into springtime, the first warm day after a cold spell, whoever's on call, pretty much guaranteed you're going to get hammered because people take that first opportunity to go out and to get crazy. So yes, warm weather is a risk factor.
All right. In your opinion, how can we better educate children and adults, but I think especially children, on just eye safety and preventative measures to take?
Well, I think we're doing a pretty good job in schools. Now, thinking back when I was in school, nobody ever talked about safety at all. When my kids were in grade school, that started to come up more. And now after they have gotten older, kids these days, young kids in lower grade school, I think they're getting a lot more information about that when they're in, their classes, when they're doing things that are at risk. Safety glasses are available. They're required to wear them for certain things. Sports is another thing. When my kids were growing up, eye protection my kids were playing field hockey around the time when there was this sort of transition where traditionally nobody wore eye protection for field hockey. The argument was it limits your view. You're going to have greater incidence of ankle injuries and leg injuries because you can't see what's going on around you. But now the trend has gone, that way where even in sports, goggles are required. So that they're getting it in school, they're getting it in sports, and things like this, and just information going out to the general public. I think we're doing a great job already. We just have to keep more of the same.
Yeah, very good. Several injuries can cause damage where surgery would be needed. What are some common surgical procedures that, you mentioned cornea scratching, but can that lead to needing a cornea transplant sometimes?
There could be a scenario where you get a scratch in the cornea and you get an infection and it causes a scar that decreases vision and you might need some kind of surgery to fix that. That doesn't happen really frequently. The injuries that are going to require surgery are generally going to be penetrating injuries or really serious alkali burns. So penetrating injuries, things being, sort of projectile injuries, or even blunt trauma that's hard enough to rupture a globe. So, flying glass, broken glass, things that will lacerate the cornea, intraocular foreign bodies. So hammering metal on metal, teeth that would break off a chainsaw and be flown at high velocity into the eye. That, more commonly is what we're going to see. Motor vehicle accidents, things like that, somewhat, but, airbag injuries don't usually lead to immediate need for surgery. But surgeries, the type that would be required, basically the goal is going to be to close the hole and to take out whatever is in there that shouldn't be in there. So if you have an intraocular foreign body, you got to get it out. If there's a laceration in the cornea, there's a hole in that, you got to close it. And the second thing is then prevent infection. So frequent, strong antibiotics, close follow-up until things stabilize. And at that point, potential surgery to reconstruct whatever was going on. So immediately, urgently, close the hole, get out the foreign body, and prevent infection is what we got to do.
Jenny, if I can follow up with a comment about surgery. So about 3 or so years ago, Dr. John Meyer and I collaborated on a book called One Eye or Two. This is not a marketing book. This is a book that explains different types of surgeries, from LASIK, which is an elective cosmetic surgery, so that you typically don't need to wear correction, need glasses. It also explains cataract surgery. It also explains different types of corneal procedures and surgeries, which Dr. Meyer is involved in. Again, it is not a marketing book. It is designed for the public to read. As I like to say, you can read it without any reference to us, whether you're in Louisville, in Los Angeles, or in London. It also has about a 15-page glossary of eye terms at the end. So we continue to get good ratings on Amazon, where it's available, and on Google Play. But just for calling us, we will be happy to let you pick up a copy of your own without having to pay a fee. It's intended as something to help the public good without us either having a marketing event or generating book profits. So One Eye or Two is a book we collaborated on.
All right, thank you for sharing that. So this is the last question I have for you, and then we'll wrap up. So October is coming. Sorry, I'm tongue-tied now. October is also Halloween Eye Safety Month. So can you share any tips for parents or children to kind of protect their eyes during the upcoming celebrations for Halloween?
Well, I think it all, again, kind of goes back to safety glasses. You're doing something risky. trick-or-treating hopefully is not going to get to the point where that's risky. But other things, haunted houses, haunted forests, things like that. There's a lot that can happen that is unexpected and startling. So there's the potential that if something happens that's startling and the reaction to that then causes a cascade of events. You may turn and run away from whatever it is into something. Someone near you may shriek and jump and hit you with something. Those kind of things, just sort of be aware, be alert to what's going on around you. Haunted forests, things like that. It would not be a bad thing to have a pair of glasses on while you're going through. Everything else, Halloween, maybe not one of the high risk holidays. 4th of July comes to mind for everybody, that fireworks injuries, just be careful when you're working with things like that. But fortunately, Halloween is one of the more sedate holidays. And unless it has somewhat to do with if it's there's a potential of having some alcohol related injuries that could be a problem, but for the kids and all of that, should not be an issue.
Well, one question I had was about contact lenses that are made to kind of make your eye look like, they're costume contact lenses. And I'm assuming, just from my job, I know enough to not trust that, but I wanted to get your opinion on those and kind of whether people should steer clear of those or not.
Well, I didn't even think of that. They do. There are these decorated contact lenses that can make your eyes look kind of interesting. But most of them are basically just the same as the regular contact lenses. They're just tinted and painted to look different. So, but there are a variety that you can get, which, really don't have the same rigorous quality control that other contact lenses may. So one issue would be, if you're going to wear something like that, make sure it's made by a reputable manufacturer. Some of the major contact lens manufacturers have things like that. I would trust them, no problem. If it's something that you can get from China off of Amazon, I would be really hesitant to put anything like that in my eye. But the other part is, if you are accustomed to contact lenses, you're used to wearing them, you're used to handling them, then you should be able to handle one of those just like anything else. If you don't wear contact lenses and you take this as your one annual opportunity to put them in, just got to make sure that you know how to handle them. You know how to put them in cleanly. You know how to get them out. You know how long you can wear them. Most contact lenses, you got to kind of build up your wearing time. You can't go from not wearing them all to wearing them for a full day, all in one shot without causing some potential problems. So buy good materials, wear them ahead of time slowly to get used to them. And just be good about handling them, and that should be okay.
All right. Well, that's all of the questions that I had. Mr. Prussian, do you have anything to add before we wrap up here?
Thank you for having Dr. Meyer on. We appreciate it.
All right. Well, thank you all for joining us, and we hope that you all have a good rest of your day. And we look forward to seeing you both soon.
Great. Thanks a lot, Jennifer.
All right. Thank you.
Bye.